Personality disorders are a group of mental health conditions characterized by enduring patterns of behavior, thinking, and functioning that differ significantly from cultural expectations. These patterns can lead to difficulties in relationships, work, and daily functioning, as they often cause distress both to the individual and to those around them. The behaviors associated with personality disorders typically emerge in adolescence or early adulthood and are stable over time. Classification of personality disorders. The Diagnostic and Statistical Manual of Mental Disorders (DSM-5) classifies personality disorders into 3 clusters based on similar characteristics. Cluster A: odd or eccentric disorders. Paranoid personality disorder, characterized by pervasive distrust and suspicion of others, believing that others are out to harm or deceive them. Schizoid personality disorder, marked by a lack of interest in social relationships, a tendency towards solitary activities, and emotional coldness or detachment. Schizotypal personality disorder involves acute discomfort in close relationships, distorted thinking, and eccentric behavior. Individuals may have odd beliefs or magical thinking. Cluster B: dramatic, emotional, or erratic disorders. Antisocial personality disorder, characterized by a disregard for the rights of others, impulsivity, deceitfulness, and a lack of remorse for harmful actions. Borderline personality disorder involves instability in interpersonal relationships, self-image, and emotions, along with impulsive behaviors. Individuals may experience intense episodes of anger, depression, and anxiety. Histrionic personality disorder, characterized by excessive emotionality and attention-seeking behavior. Individuals often seek reassurance and approval and may be uncomfortable when they are not the center of attention. Narcissistic personality disorder, marked by a grandiose sense of self-importance, the need for admiration, and a lack of empathy for others. Cluster C: anxious or fearful disorders. Avoidant personality disorder, characterized by a pervasive pattern of social inhibition, feelings of inadequacy, and hypersensitivity to negative evaluation. Individuals may avoid social situations due to fear of criticism. Dependent personality disorder involves an excessive need to be taken care of, leading to submissive and clinging behaviors and fears of separation. Obsessive compulsive personality disorder (OCPD), characterized by a preoccupation with orderliness, perfectionism, and control over one's environment at the expense of flexibility and efficiency. Causes. The exact causes of personality disorders are not fully understood, but they are believed to result from a combination of genetic, environmental, and social factors. Genetics. Family history may increase the risk of developing personality disorders. Certain traits may be inherited, influencing an individual's temperament and personality. Environment. Childhood experiences, including trauma, abuse, neglect, or significant loss, can contribute to the development of personality disorders. Social factors. Cultural and social influences, such as family dynamics, peer relationships, and societal norms, can play a role in shaping personality traits. Symptoms. Symptoms vary widely depending on the specific personality disorder but may include distorted thinking, inaccurate perceptions of self and others, emotional instability, difficulty regulating emotions and mood swings, impaired relationships, difficulty forming and maintaining healthy relationships, impulsivity, acting without thinking about the consequences, fear of abandonment, intense fear of being rejected or abandoned by loved ones, self-destructive behaviors, engaging in risky or harmful behaviors, perfectionism, excessive concern with details and orderliness that interferes with completing tasks. Diagnosis. Diagnosis typically involves a thorough assessment by a mental health professional, which includes clinical interview, discussing symptoms, personal history, and family history to assess patterns of behavior and emotional responses. Standardized assessment tools. Structured interviews and questionnaires can help evaluate personality traits and symptoms. Diagnostic criteria. The DSM-5 criteria for specific personality disorders must be met for a formal diagnosis. Exclusion of other conditions. It's essential to rule out other mental health conditions that may mimic symptoms, such as mood disorders or anxiety disorders. Treatment for personality disorders often involves psychotherapy, medication, and lifestyle changes. However, the effectiveness of treatment can vary based on the specific disorder and individual circumstances. Psychotherapy. Cognitive behavioral therapy (CBT) focuses on changing negative thought patterns and behaviors. Dialectical behavior therapy (DBT) especially effective for borderline personality disorder. DBT helps individuals manage emotions and improve interpersonal relationships. Schema therapy addresses deep-seated patterns and beliefs that contribute to personality disorders. Psychodynamic therapy explores unconscious thoughts and feelings to understand how past experiences shape current behaviors. Medications. While there are no specific medications for personality disorders, medications may be prescribed to treat co-occurrent symptoms, such as anxiety, depression, or mood swings. Options may include antidepressants, mood stabilizers, or antipsychotic medications. Supportive therapy. Support groups and psychoeducation can help individuals and families understand the disorder and learn coping strategies. Lifestyle changes. Encouraging healthy lifestyle choices, such as regular exercise, balanced nutrition, and good sleep hygiene, can support overall mental health. Complications. Untreated personality disorders can lead to several complications, including increased risk of other mental health disorders, high rates of co-occurrent conditions such as depression, anxiety, substance use disorders, and eating disorders. Relationship issues. Difficulties in maintaining healthy relationships with family, friends, and romantic partners. Occupational challenges. Problems at work, including difficulty with teamwork, authority figures, and job retention. Social isolation. Withdrawal from social situations due to fear, anxiety, or interpersonal difficulties. Self-harm and suicidal behavior. Some individuals may engage in self-destructive behaviors or have thoughts of self-harm or suicide, particularly in severe cases. Prognosis. The prognosis for individuals with personality disorders can vary significantly based on several factors, including the specific disorder, severity of symptoms, willingness to engage in treatment, and support systems. Some people may experience improvement over time, especially with appropriate treatment and interventions, while others may continue to struggle with symptoms throughout their lives. Conclusion. Personality disorders can significantly impact an individual's life and relationships, but understanding and addressing these conditions through appropriate treatment can lead to improved functioning and quality of life. Early intervention, ongoing support, and comprehensive treatment plans are essential for managing symptoms and fostering personal growth. If you or someone you know may be struggling with a personality disorder, seeking help from a mental health professional is crucial.